Since 2010, your insurance must cover a number of services at no cost to you. These are preventive services. Today, let's go over the basics and what is covered for adults and men especially. Welcome, I am the Medical Bill Whisperer, a previous billing manager turned patient advocate. I am committed to bringing answers, insights, and solutions to patients like you. First, a disclaimer. If you have Medicare, whether Original or Advantage, or Medicaid or TRICARE, these programs have their own preventive services, and this video does not really apply. So who is eligible? Well, if you or your employer have bought a plan through a marketplace or Obamacare exchange, or on the open market through an insurance agent, or if you have a self-funded plan that allows for such coverage, then great news, you are covered. What does it mean? Your insurance must cover preventive services without charging you for any liability, deductible, copay, or co-insurance, even if you have not met those yet. Yay! So what services exactly are we talking about? Well, preventive care would mean a yearly well visit, an assessment of your health habits, documentation of your personal and family health history to determine risk factors. How healthy are you? What is your lifestyle? Can it be improved, especially through early detection? A physical exam, including some tests or labs, can help detect diseases early when they are easier to treat. Screenings will not only extend to your physical health, including blood pressure, cancer risk, obesity, diabetes, STDs, cholesterol, and more, but also your mental health. Are you depressed, drinking too much, not sleeping enough? This would lead to risk reduction strategies, including immunization, cancer screening such as mammograms or colonoscopies, but also services to improve your health through lifestyle changes and support, education and counseling that help you make informed health decisions. Set some goals. Get advice and support when dealing with an issue or condition. It is said that an ounce of prevention is worth a pound of cure, or in this case, thousands upon thousands of dollars. So let's take advantage, shall we? Screening tests and checkups are free and can help detect health issues early when they are cheaper and easier to treat. Any health problem can be maintained, preventing it from worsening and costing you much more than an arm and a leg down the line. Reduce your risks, reduce your bills. Now, while adults have a whole range of free services, there are a couple specially for you guys. One is the abdominal aortic aneurysm screening. The other one is detection for testicular and prostate cancers. Now, some tips. Remind the staff when you make an appointment that this is a preventive visit or service, and do remind the doctor at the time services are rendered. Coding is essential to get those services paid by your insurance and not out of your pocket. Services are free only when delivered by a provider that is contracted with your plan's network. You can find one of those by calling your insurance company directly or through the online portal Find a Doctor option. If, God forbid, something odd would be found on a test or a scan, services to further diagnose the issue or cure it would be considered diagnostic or therapeutic services, therefore no longer preventive. The share of cost and terms of coverage of your plan would then apply. You would be responsible for deductible, co-pays, and co-insurance. And there are some limits for certain procedures. For example, a colonoscopy can only be had once every 10 years under preventive care, and some screenings for cancers only start at age 45 or 50. And the well visit is usually only once a year. But do take advantage. These free services under preventive care have a main objective not only to save you money, but to shift the way medicine is given to you from a reactive and curative model to one that can preserve your health and help you deal with whatever issue may arise early enough to be both able to treat it quickly and better and at a lower cost using fewer resources. I will place some links for additional information and resources below. But I do thank you for watching. Your likes, comments, and subscribe help this little channel grow a little bit at a time to reach out to more patients like you. So thank you.